Taoiseach, at a recent Public Accounts Committee, the Chief Executive Officer of the Health Service Executive admitted that the HSE is facing a potential deficit of €500 million if corrective action is not taken. And he said to break even there would be significant impact on services for the remaining of the year. He added that, and I quote, "Assumptions on which the HSE's 2012 service plan has been based are no longer valid." And according to Deputy DC, who received an off-the-record reaction from the CEO, quote, "The HSE would have to close wards, beds and possibly hospitals." There are hospital managers, Taoiseach, around the country that are at the end of their tether and genuinely worried about the budgetary situation, given the cuts in their allocation already and their inability to make ends meet. And what is clearly emerging, Taoiseach, is that the health estimate for 2012 was not an honest estimate. And the CEO makes the point that in the plan, which the Minister oversaw and approved, the assumption was that we would save €124 million in drug payments via a new pricing agreement with the industry. Quote, "That has not come through." The assumption, or the plan, was for €140 million in additional income, of which €75 million would come from charging private patients in public beds. Quote, "That assumption is not yet deliverable." Reducing our agency cost by 50% was a further target. Now, given that agency staff will cost €200 million this year, he's now saying that the 50% target was never a realistic figure, a realistic target. In essence, Taoiseach, and I would ask you, and put this to you, that the failure to implement measures announced in the December budget in relation to health is one thing, but it seems clear now that these figures were never achievable, and that what you stand accused of, and the Minister in particular, is that in essence that the books were cooked here to give an estimate, and a very false and dishonest estimate was provided for in health. And that is why on the 8th of June, the Minister lashed out at the workers in the health service, saying he wanted allowances and premiums and everything else cut now all of a sudden, and that people needed to get their act together.
Thank you,
but the reality is the act wasn't got together at the time of the budget, and false figures that were completely unachievable were put into that health estimate. And now we're facing the prospect of ward closures and bed closures because of the failings of the Minister and the government in this respect.
Taoiseach, to reply.
Taoiseach, clearly the
order, please.
I think it's ill-becoming of you to accuse the Minister for Health of being dishonest in the presentation of his estimate for the budget for 2012. That's not in keeping with your normal behaviour, Deputy Martin. Clearly, the HSE is facing a serious challenge this year. We're at just beyond the halfway point, and the HSE's performance report for April shows a net deficit of €200 million. Hospitals account for €106 million of the deficit, and community services are €57 million overspent on that report. €13 million of the community services deficit relates to childcare. Primary care reimbursement service, including medical cards, is showing a deficit of €45 million. The HSE themselves have outlined possible approaches to dealing with this financial situation, including reducing the use of agency staff, implementing reforms under the Croke Park Agreement to achieve more effective use of human resources. The HSE has submitted a mid-year cost containment proposal, which the Department and the Minister are considering. The Department of Health, as you're aware, has indicated that 70% of the HSE's €13 billion budget is pay. Of this, 18% is classified as non-core, such as overtime, premium payments and allowances that are paid to staff. And in the context of a health service that has to run a 24/7 effective service, it's imperative that ways be found of addressing that growing deficit. So don't accept that your assertion that the Minister for Health was dishonest in the presenting of his estimate for this year. It's a fact of life that every minister has to work very hard to see that the ceilings and the proposals for their particular department's budget for 2012 are adhered to, and the same will apply in the case of the Department of Health and the Minister for Health. And he's working very hard both with the Department and the HSE to address the deficit that I've mentioned.
Margaret, supplementary question from the Deputy Micheál Martin.
You didn't deal with the core issue, Taoiseach. Completely unrealistic and unachievable figures were put into the health estimate. Legislation even to give effect to them hasn't even come before the House. And we're now 2 or 3 weeks to the recess. These were false figures that were put into this estimate. 143 under the private income in private patients in public hospitals, 124 in demand-led schemes, and agency staff. Cathal McGee is saying totally unrealistic, never realistic, to say we're going to cut agency staff by 50%. And now you trot out agency staff again for the rest of the year. The bottom line here, Taoiseach, is these were false figures. And we need answers, and we need clarity as to how this estimate was put in. And I would accept that there can be overruns in expenditure. There clearly can be overruns in expenditure. But what's clear from this, and the dogs on the street in health are saying it, Taoiseach.
Thank you,
Anyone who knows anything on the ground in health are saying there is never a chance, there is never a hope in hell of any of these figures coming to fruition or realisation.
Thank you,
They
Deputy.
were false figures, Taoiseach. And I want to ask you, Taoiseach, are you going to correct them? And can we get a realistic estimate now for the remainder of the year? And can you give a guarantee here, Taoiseach, that frontline services will not now be affected because of the Minister's failings and incompetence in relation to this estimate, and maybe much more in relation to this estimate? Because we've got no clarity from anybody in health or from the Minister about it.
Taoiseach,
When you had the opportunity and the privilege of serving as the Minister for Health yourself, the answer was, on every occasion that there was a difficulty, was to throw millions into the maw of the public health service, and you were not able to deal with the situation because you never had the courage to face up to doing what needed to be done. That's the long and the short of that. That's the argument that you always come up with. Actually, in respect of tackling the real problems here, Minister Riley has brought about a 20% drop of the numbers of patients who are on trolleys, 10,000 less in the first 5.5 months this year. We now have a situation where 1.8 million people, more than ever before, are covered by medical cards. There's been an increase of 6% in respect of the emergency department admissions and 7% inpatient discharges. So the effective frontline service, which you talked about, catastrophic consequences back at the end of February, when significant numbers left the public service with voluntary redundancy, did not happen because the clinical teams, the medical teams and the managers on the front line signed up for their individual programmes and plans, and that's being implemented. And insofar as frontline services are concerned, we can take it that the Minister for Health is working with all his people, and in fact Cork University Hospital is now one of the best performing hospitals in the country because of the changes that have been made. I don't accept your assertion of either falsehood or dishonesty or hard work.
Sorry, Deputy. No. Please, Deputy.
The CEO said it last week.